The uterus is a hollow, muscular, upside down pear shaped organ located in the female pelvis between the bladder and the rectum, between the urethra, really, and the rectum. It's composed of three main regions: the fundus, which is this broad, curved upper region on the top, and the fundus, it extends above the openings of the uterine tubes. There's the body, which is the central portion where implantation of an embryo typically occurs. And then there's the cervix, which is the lower portion that projects or protrudes into the vagina. The cervix is further divided into the internal os, which marks the opening between the uterine cavity and the cervical canal, and the external os, which opens into the vaginal canal. So just above the internal os also lies the isthmus, which is a slightly narrowed region connecting the body of the uterus to the cervix. Oh, I forgot about the adnexa, which is usually this area between the uterine tubes, ovaries, and uterus itself. Extending laterally from the uterus are the adnexa, a term that refers collectively to uterine tubes, ovaries, and any other structures like supporting ligaments in that area. The broad ligament, which is like this big sheet here, it supports the uterus and houses the fallopian tubes, ovaries, blood vessels, nerves, lymphatics. The round ligaments, which I have pictured here, they help maintain that anteverted position of the uterus, and the uteral sacral ligaments anchor the uterus posteriorly to the sacrum. The mesovarium, which is this area up here, it's a little tiny fold of the peritoneum, and it connects the anterior surface of the ovary to the posterior layer of the broad ligament of the uterus. It acts kind of like a small mesentery. I don't know if you remember those from the digestive section. So it acts as a mesentery, providing a pathway for blood vessels, lymphatics, and nerves. The uterosacral ligaments, they're paired, and they're like these little fibrous bands that extend from the posterior aspect of the cervix and upper vagina to the anterior surface of the sacrum. They play a big role in maintaining the position of the uterus within the pelvic cavity, and the uterus usually has its anteverted position because of the anchoring of the uterosacral ligaments. These ligaments are situated lateral to the rectum and medial to the ureter. So think about that for a moment. And they form the lateral boundaries of the recto-uterine and recto-vaginal spaces. Now, if you have had a baby or are over the age of 50, you know exactly what I'm talking about. Structurally, each uterosacral ligament comprises a superficial part made of smooth muscle, connective tissues, and adipose tissue. And then there's a deep part that contains a splanchnic nerve. The innermost layer of the uterus is the endometrium, which is technically a mucous membrane because it's open to the outside, and it undergoes cyclic changes in responses to hormones. The endometrium thickens during what's called the uterine or the menstrual cycle in preparation for implantation of a fertilized egg. But if pregnancy does not occur, then the endometrium is shed during menstruation. The endometrium has two sublayers. It has the functional layer, sometimes called the tunica functionalis, and that's the layer that's shed and rebuilt every month. And then there's the basal layer, which is sometimes called the tunica basale, which regenerates the functional layer each cycle. But the basal layer, it never gets shed, it's permanent. The middle layer of the uterus is the myometrium, and this is a very thick layer of smooth muscle that's responsible for the uterine contractions that occur during menstruation, small ones occur, during labor, which huge ones occur, and delivery. This layer enables the uterus to expand during pregnancy and contract during childbirth and help push or poop the baby out. You don't poop the baby out. Although I do have a slide that says you eject the baby, which is a little harsh. Anyway, the outermost layer is called the perimetrium. It's a pretty thin serous membrane compared to the adventitia that covers the vagina. And it covers the outer surface of the uterus. It's kind of like part of the peritoneum. It like the mesovarium is like a fold of the peritoneum. The basal layer of the uterus is considered to be the deeper or more stable layer of the endometrium. That's all of that there. The basal layer, it does not shed during menstruation. Instead, it remains intact and it serves as the foundation for the regeneration of the functional layer after each menstrual cycle. The basal layer contains stem cells, and that's what enables the renewal of this endometrium. The functional layer of the uterus is the innermost part of the endometrium, and it's responsible for thickening, and I'm just going to put that right there, for thickening in response to hormonal changes during the menstrual cycle. The functional layer is where the embryo would implant itself if fertilization occurs. In my diagram, you can see that there are these arteries and veins that are growing up from the basal layer of the endometrium up into the functional layer. These arteries are called coiled arteries because they have a very characteristic appearance of coils. However, the veins, they don't share in that coiled structure. As the functional layer grows and builds pre-ovulation, mucus glands, like this one here, they invade the functional layer. But notice how the coiled arteries are growing up from the basal layer and the mucus glands are extending down from the lumen. Endometriosis is a medical condition in which tissues similar to the endometrium, specifically the functional layer, grow outside the uterus, and most commonly on the ovaries, on the uterine tubes, on the pelvic lining, sometimes on digestive organs. These little displaced tissue patches, they still respond to hormonal changes during the menstrual cycle. And these patches, they actually thicken and break down and they bleed as they would if they were inside the uterus. Right? That does sound horrible. However, because of the tissue is outside the uterus, it's got no way to exit the body. It can cause inflammation, pain, scarring, adhesions between organs. The symptoms of endometriosis can vary incredibly, but they often include chronic pelvic pain, especially during menstruation, painful intercourse, heavy menstrual bleeding, and in some cases, infertility, which can sometimes be when it is first discovered. The exact cause of endometriosis is not fully understood. There are many theories, and some of them include a theory called retrograde menstruation. There are autoimmune system disorders, and we've been looking at genetic factors as well. Treatment options are not great. They involve pain relief medications. They involve treating the symptoms. And they can also involve hormonal therapy to reduce or stop menstruation, so like a progesterone-only pill or an implant. You also can have surgical removal of the endometrial-like tissue in severe cases. Most of the times that does need laparoscopy, like opening the gut, and you don't want to do that if you don't have to. That's just my personal opinion. However, many of these surgeries these days, they don't require a complete opening. Some of them can be done a little bit with smaller incisions.